Good afternoon. Welcome to the daily briefing at the St. Clair County Emergency Management Agency, where I'm joined with Chairman Mark Kern from the County Board and Barb Holt, Director of the Health Department. Barb, we got numbers today, and I'm excited. We've got a special guest with us that I think members of Team St. Clair had asked for us to get a pediatrician in, and we've got a lot to talk about today.
Yes, I'm looking forward to it as well. And welcome back, folks. We have a lot of statistics and a lot of great information for you today. So we'll start with the numbers. Unfortunately, we're hanging around the 70s number, 78 new positive cases of COVID in St. Clair County today. Again, these were children under age of 10 all the way up to folks in their 90s. Our positivity rate, just a daily positivity for St. Clair County only, was 8.8% today. That's based upon 885 test results with these 78 positives. So the totals for St. Clair County, you had 52,111 tests conducted so far. Of those, 5,005 were positive, 47,106 were negative, and we're very happy to report there are no deaths in St. Clair County today due to COVID. Also, we have over 4,184 folks that have completed the IDPH required 10 days of isolation of those positive cases. Statewide, we have tested 3,439,272 folks. Of those, 209,594 were positive. This is an increase for a day of 1,740 positive cases in the state of Illinois, and unfortunately we have a huge increase in deaths today of 27 for the state of Illinois, for a total of 7,782 deaths due to COVID-related illness. In St. Clair County, our hospitalization, we have 46 COVID-related patients, and right now we have 3 patients that are on ventilators in St. Clair County. So again, for all those folks, they're in our thoughts and prayers that they recover quickly. As far as congregate living centers, we have 1 new case to report at Brea in Belleville for a total of 65 cases and 7 deaths. Additionally, yesterday we had the drive-through testing, very successful testing in Shiloh yesterday for 235 test results. Today we're at Belleville West for about another half an hour till 4 o'clock. That too is a drive-through. And then on Friday, we'll be testing at Moody Park from 8 to 4. Moody Park is off Longacre and Ruby Lane. Again, that's a drive-through. And these are all the nasal pharyngeal tests. And please, again, we're very busy. Our phones are very busy. As soon as we get the test results, we will be letting you know. Please don't call us. We will call you as soon as we get your test results. So please be patient, but we'll get them to you as soon as we can. Additionally, as we all know, yesterday the governor announced a resurgence plan for the next 14 days. They'll review it again September 1st, but a few things I just wanted to highlight and reiterate. We're getting a lot of phone calls. All bars and restaurants are supposed to close at 11 o'clock. That's for Region 4, which includes St. Clair, Madison, Randolph, Bond, Monroe, Clinton, and am I missing anybody? Washington. Oh, my hometown of Washington, Nashville, Illinois. That's where my family's from. So those 4 counties are to close the bars at 11. Again, anybody in bars or restaurants, the general rule is no standing, no congregating. If you're going to be there, you need to be seated. No seating at the bars. You need to be seated at a table. And the rules say tables need to be 6 foot apart. Well, technically what that means is individuals that are seated at that table from one table to the next, those individuals have to be 6 foot apart. That's, again, the social distancing. So it's 6 foot. Just because the tables are 6 foot, the people at those tables need to be 6 foot apart. Again, a couple other things. Everyone needs to be masked at all times. So unless you're eating or taking a drink, take a drink, put your mask back on. You're required to wear those masks. We've been talking about wearing the mask forever and ever, and this is exactly what we need to do. Doc Venturi will talk about the need for the mask and how important this is, and it's the best medical tool we have at this time. So we'll hear more about that from the doctor. So again, Lots of stuff going on, and we're trying to battle this as best we can, sir. Chairman, what else do you have for us today?
I think everything going well. You're tracing and tracking. Are you discovering any new places that people are contracting? We've gotten a couple complaints about large funerals that are moving out of a funeral parlor into a church to get a bigger venue, and they're hosting hundreds of people. That's really not within the spirit of what we're trying to do here, is it?
That's exactly correct. According to the new resurgence guidelines, social events and gatherings are not supposed to be more than 25 people. We did check with DCEO, that's the state agency that oversees all the guidance and the rules. And the rules for churches technically haven't changed, but they highly encourage no one more than 25. But if you do have more, follow those guidelines, social distancing, people seated in your church, make your reservations so they seat from the front to the back, and all the cleaning and the masking, and minimize the singing and any type of interaction between groups.
And it's difficult with a funeral, but most people
Yes.
are delaying those, and they'll have services later on after we get through COVID, and we do encourage that. With a lot of crying and things that go on at funerals is a way to spread COVID pretty quickly.
Absolutely, and it's a very sad time, and when families do get together, and especially at funerals, and we're humans, and we interact by touching and hugging, and obviously everyone's sad for the passing of their family or their friend, but we don't want to spread this disease any further, or let's hope it never happens, but us be one of those in the casket because of COVID, and that's happened to many folks. We have 160 folks in St. Clair County that have died of COVID. Let's not be one of them.
And so I saw the stack of forms on the desk, ready for the deputies and the health officials to go out and make sure that everyone is complying. And you're very reasonable when you go out. We're asking people to comply. This isn't about gotcha. This
Right.
isn't sending people undercover to try to catch people with a mask off or anything. We just want to make sure people are complying. Isn't that right?
Absolutely, and that's our public health mission, and has been all along. Our mission is promote, protect, and educate. That's what we do for folks, and we sent our guidance, our notice out to all the food service facilities that, according to our county food sanitation ordinance, if you are doing something that promotes an imminent health hazard and not wearing these masks in the public is an imminent health hazard. So they can lose their food permit as well as the liquor commission. You can lose your liquor license, your business license. We need to protect folks. Nobody wants to go back to phase 3. I mean, we're doing the best we can and testing and contacting folks, but we really need to, ensure if you get the phone call to say, hey, you're COVID positive, you need to isolate, and anybody else in your household needs to quarantine, they need to follow those rules. And one other thing I wanted to mention, and this is another, I bet we get this question 50 times a day, is, well, I tested negative, but am I still quarantined? Absolutely. You need to be quarantined for that full 14 days of the last time you were in contact with that positive case, and that's because anywhere within that 14 days, that virus may become active in your body. You may not show it on a test at day 2 or day 5, but it can show up on day 14, and then you can spread the disease. So again, you can't test yourself out of quarantine.
That's very good. We appreciate that, Barb.
Thank you, sir.
Okay, we'll move into the zip code report for today. In 62059, we remain at 10. 62201, we go up 3 to 207 today. 62203, we go up by 1 to 168 COVID positives. 62204, we go up by 2 to 126. 62205, we remain the same at 172. 62206 goes up by 3 today to 372 people. 62207 goes up by 1 to 220. 62208 goes up by 3 to 320. And 62220 goes up by 4 to 397. 62221 goes up by 5 to 458. 62223 goes up by 10 to 279. 62225 goes up by 1 to 20, and 62226 goes up by 7 to 530. 62232 goes up by 1 to 116. 62239 goes up by 4 to 64. 62240 stays the same at 19. 62243 goes up by 1 to 40. 62254 goes up by 1 to 152. 62255 stays the same at 14. 62257 stays the same at 26. 62258 goes up by 3 to 90. 62260 goes up by 5 to 85. 62264 stays the same at 72. 62269 goes up by 9 to 378. And 62285 goes up by 1 to 49. So in the past couple of weeks, we're all thinking about school. We're thinking about more emphasis and worries about our children. So we thought it was important, and we're very honored today to have Dr. Guy Venuti. The doc is a pediatrician from HSHS Hospital System. Welcome, doctor. We appreciate you being here today.
I'm equally honored to be here. Thank you.
So let's talk a little bit. We had our 78 new cases today that were all age ranges, from under 10 all the way through the 90s. We know that about 9% of those in the country that get COVID are children. Can you talk about basically what those numbers are, what you're seeing, and maybe how a parent knows when to come see you if they suspect there might be an issue?
Sure. As you said, a very small number of actual cases are children, around 9%. We think that's owed to the child's previous exposure to other coronaviruses as they were growing up, and so their response is not as brisk as we see in adults. Knowing when to come visit us as a pediatrician would be if your child is not exhibiting any of the symptoms that are typical for a viral infection: runny nose, cough, congestion, fever. And if they're getting worse, then obviously we need to hear from you and need to see you in clinic.
So how about babies? With features like smaller airways, is there a more of an alarm bell that goes off with a child under 2 years old?
Generally, that's the rule in pediatrics, is when the kids are that much smaller, we spend a lot more effort on taking care of them and making sure they're doing okay. There are other viruses like RSV, respiratory syncytial virus, that also affects younger babies to a greater degree. And so with COVID, you're absolutely spot on in saying that there's smaller airways and their propensity to be sicker. And we don't always know what's happening with younger babies either, so they can't tell us, hey, this is bothering me, or hey, this is bothering me, it hurts, or other details about that child. It becomes a little bit more problematic.
So do children react the same to COVID as adults generally? Are the symptoms the same? Are there some nuances that maybe that you know of?
Sure. So for kids, it can vary anywhere from abdominal pain, diarrhea, vomiting, runny nose, congestion, fevers, headache, malaise, typical viral symptoms. Now, kids don't respond as briskly to the COVID virus as, say, adults do, and there's some thought, maybe not conclusively yet, that adults are responding much more aggressively to the virus, and so they're getting sicker. However, when kids are affected, they are shown to be hospitalized at a higher rate than, or an equal rate to adults.
So you talked about the children have a certain amount of immunity from, I guess, the amount of germs that they're exposed to in preschool and daycare and those type of things. Does that enter into things? And should we be making extra sure that vaccinations, flu shots are in place this fall, given that COVID is going to be around for a while?
Sure, great question. Just because COVID's here doesn't mean everything else is taking a vacation. So we have to make sure that we're doing all of our immunizations for our babies. at the right intervals and making sure that they're healthy so that if they do get sick, they're prepared. Flu shots are huge. I think my personal philosophy is that I think people are going to start thinking about the flu shot a little bit more this year. And I think that's great, and I think we should see more people getting the flu vaccine.
So let's talk a little about school, because although much of St. Clair County is going to do remote learning, I think at some point parents are going to want, some parents are going to want their children to get back into schools. Can you talk a little about what that is going to mean, and maybe are there extra precautions, or how do you think all that should work? I guess it may be a personal view and it may be a professional view, and we welcome both.
Sure, thanks. Well, professionally, the American Academy of Pediatrics is really interested in seeing kids get back to school, especially as schools are a great way of sort of addressing inequalities and other things with kids. So we want kids in school, we want them to socialize, we want them to get back to doing what they were doing. Having said that, we also want them to be safe when they're doing it. So we want kids to have, depending on their age group, to have lunch in cohorts, to travel on the bus in cohorts, to rotate out teachers instead of students, and to make sure that as they're moving through the schools, they're doing it in a way that doesn't promote illness or infection. So I think that is probably, that accompanied with the thought that we want those kids that are at a higher risk for things like physical or sexual or emotional abuse that are trapped at home, to get them back into the school setting where they're surrounded by mandated reporters and have a chance to get away from those negative environments.
And the CDC guidelines that have been set up with, making sure everything's disinfected and the wearing of masks.
Absolutely.
Fairly sufficient, I assume.
I think social distancing, wearing masks, as long as it's age appropriate, because honestly, you can't keep a mask on a 2-year-old. So I think as long as it's an age appropriate intervention, washing hands, singing the birthday song for 2 episodes and getting that done, and keeping kids masked when they need to be masked, and keeping them separated, social distancing. There is some suggestion that 3 feet when kids are asymptomatic and wearing a mask is as effective as 6 feet. Again, not conclusive, but there is some discussion about that.
And is that because they don't have as powerful airwaves?
Well, I think the 3 feet has been determined that that's sufficient. If they're not symptomatic, they have no cough, no other symptoms, then they don't need to be that far away as long as they're masked.
So let's talk a little about masks. So there are going to be some children that can't wear masks.
Sure.
Can you kind of elaborate a little bit on where that is?
Sure. So there's a certain subset of kids that will have a difficult time wearing a mask. Those kids with cerebral palsy that require frequent suctioning, kids with severe airway disease, cystic fibrosis, kids with severe asthma, and kids that have sensory issues. Obviously having something on your face is all new to us, and it can become disturbing, and it can become a little bit of a nuisance, for us. So if you can imagine a kiddo who can't tolerate the texture of the mask, let alone having it on his face or her face, that becomes a problem as well.
So it may be a little different discipline of medicine, but a pregnant mother, if the pregnant mother gets COVID, can that be passed on to the child? And maybe I should have...
Sure, it can, but it's in a very small subset of cases. Anywhere from 2 to 5% of kids that are born to a mother that has active COVID infection will get some signs of the syndrome after delivery.
So, and I guess that goes back to, so kids seem to have some sort of maybe and a little immunity to COVID-19, but they still can get it and carry it,
Sure.
Which is they can bring it home, and even though they won't have symptoms, that can enter the household. If the mother's pregnant, if there's an infant child in the house, still something to consider.
Sure. So I hope this comes off right, but not to correct you, but immunity is
Please.
probably not the best word for it. I don't think anyone's immune to it. What I think is that they become asymptomatic carriers. And so they don't get as sick as, we discussed before. There's a number of coronaviruses that kids are exposed to that are typically manifested as a cold, runny nose, cough, congestion. And so there's some similarity between those coronaviruses that allows them to become asymptomatic carriers. So they do go home and they do expose mom and dad and therefore other people that are in the home to that illness.
And there are just some people who, for whatever reason, are asymptomatic carriers and
And they don't spread it. Oh, they have the ability to spread it, but they don't become ill themselves.
So can we talk a little about COVID-19 and just a lot of people, as Herb Simmons always says, there are people who comment and say, this is just the flu. Can you respond to that
sure.
a little bit?
Sure. If it was just the flu, back in 1918 we had at least 28 million deaths, and we saw the average life expectancy of the average American male drop 10 years. And so saying it's just the flu is a bit of a misnomer. We don't want to see it get to that level. And so we need to be proactive. We need to wear masks. I think back in 1918 there was some suggestion that the flu was over, and so people started to have a parade, and we saw a huge number of new infections from that parade. So we have to be cautious and keep our distance and do what those in authority are telling us to do.
So long-term effects of COVID. Initially, when New York, when it was really, New York was a hotspot, they talked about MIS-C, which were symptoms they were seeing in children. Can we address that? I mean, is that
Sure.
something that's still...
Sure. So that was, I think, a number of cases from both England and New York. They were identified pretty early on, and those were cases where kids got very, very sick with multi-organ failure, and they required intubation and time in the intensive care unit. And so that's a very similar illness to Kawasaki's disease, which is an inflammatory disease that we see in children, marked by conjunctivitis, dry cracked lips, red tongue, and some peeling of the fingers. It also involves some coronary artery aneurysms, and in the end can typically involve cardiology, intervention.
And did they think that was related to COVID-19? Were these just more severe symptoms, or is this something that just evolved?
I think the symptoms were seen as similar to Kawasaki's, and so they've called it the multi-symptom inflammatory syndrome in children. And so it has the hallmarks of Kawasaki's disease, so it helps us as clinicians to identify those kids that may be at particular risk for MIS-C.
And of course, we're 7 months into this, and I'm sure that the science is ever evolving.
Yes, sir. Yeah.
Any suggestions for parents out there? The kids are anxious to go back to school. There's certainly kids are very social. Humans are social. Any suggestions on how to best get through this?
Just continue to follow the guidelines that are put out by those organizations like the CDC, the WHO, following their guidelines and making sure you wear masks. Limit going outside if you don't need to. If you have a doctor's appointment, bringing just the child to the appointment and not the entire clan. And then trying to limit that time. You've gone to the doctor's appointment, then go home afterwards, and don't hit Target, don't hit Deerbergs or wherever you're going to go. Maybe go straight home from there. Other than that, I think the plan for the schools is a good one. Getting those kids back in there, getting them safe, and making sure they follow the guidelines that are set up.
So, and I'd just like to make an editorial comment that, we talk about how lucky we are to have Scott Air Force Base in our county. And
Yes, sir.
you are a product, and we talk about the retirees that stay here and help build our community, and you are one of those. So we thank you for your service, and we certainly are proud of our Scott heritage, and we're lucky that we've got Scott here that brings people like you, the good old St. Clair County, to help us out.
Thank you very much. That's
Herb
very kind.
Simmons?
Well, we just got a new member of Team St. Clair because he answered everything that a lot of our followers have been saying. It was them that said, let's get a pediatrician on here, especially with school starting. And Doc, I really appreciate that you answered a lot of their concerns and questions. And I can tell it's not only from a professional point, but from a personal point. And I think that really answered a lot of their questions, because one of the ones that always comes in is, as the chairman said, it's just the flu. Everybody's going to get it. Everybody's going to get over it. But I like the way you explained that we don't want to go back to what happened back in 1918. And
there's a lot of small businesses out there that are counting on us to follow the rules so they can stay open and we can continue to have people be successful. And I think it's important not only for kids but for the greater good that we follow what's being done and being said so that we can have everybody be successful at some point once this gets over and done with.
Well, and I think what some people forget is that it's changed everybody's life. As a physician, you've had to change the way you practice as far as people come into your office,
Yes,
and
sir.
a lot of other physicians that are doing the virtual meetings. And so it's just not one group of individuals, it's everybody that's had to change. And I think it's going to be that way for a while. So, but we really appreciate you coming in today.
And you're a small business owner too.
Oh, yes, sir. Yeah,
So
we
you,
sure
I mean,
are.
this,
Yeah.
you're affected on all sides.
Yes, my wife reminds me every day that it's her business. Yes,
Well, we tip.
but it's absolutely true. You know, and we're not the only one out there. And I think the sooner people start to see that this is not about your rights, it's more about what the greater good is, the better it'll be for everybody. But I stand by what you said. If people want to talk to me offline, I'm happy to do that too. If they want to engage and still ask me questions, I'll leave you my number, and I'm
Sure.
happy to do that for you.
We'll be good. Like I said, just for today, the amount of people that, when they heard that you were coming on here, I mean, our numbers have definitely shown that they had an interest in what you had to say. So
Flattered. Thank you.
another plus in the right direction on trying to get this COVID-19 at least understood. As you said earlier, it's new to everybody.
It is, yeah.
You know, you're learning about it just the same as we are. 8 months now.
Yes, sir.
It's not like everybody's an expert on it. So
Right.
we're all learning together, and we're learning with the best of the doctors right here. So we appreciate him coming in today. A few things on the EMA side. We received a donation yesterday from the Monroe County Electric Corporation. The chairman of the board, George Obenagel, stopped by and dropped us a check off. They were given a check to 3 of the counties, and we were one of them. We really appreciate that. It'll go for good use. We received a shipment of PPEs today from IEMA. We'll be looking to see what all came in on that, and if there's anything we can help our first responders with. Of course, that's what we're here for to do. Chairman, you talked about the funeral homes and the masses. We had 2 funeral directors call today with those questions, and everybody is, I believe, got the message loud and clear of what can be done and what can't be done. And I just want to thank those mayors that we had the conversation with, and the police chiefs. We fielded a lot of those calls yesterday from them up until late in the evening, and it started all over again this morning. So that tells me the mayors, especially O'Fallon and Shiloh, had called and getting questions for their constituents, and that's what we want to make sure we get it out there. Positivity rate for the region, 9.4. I had said it was going to be 9.1 today. I apologize. It's actually higher. Our daily was 8.8. We got to get it down. We've talked about that. We beg with you. You heard the doctor today. Wear the mask, social distancing, and we will get through this. You heard Barb talk about it, the chairman. We're talking about it till we're blue in the face, basically. It's time for you individually to step up to the plate and hit a home run. That's all you got to do. You heard the doctor say, let's just stay home if you don't have to. And I'm telling you, you hear it every day. You can either be a part of the problem or a part of the solution. Team St. Clair is a part of the solution. And please join Team St. Clair and let's get over this. We'll be back shortly with Cindy and Daisy to translate this into our Spanish communities. And we'll be back here tomorrow afternoon with the next briefing. Thank you.